Hi, I'm Jeffrey Rucker, and this is my Week 10 project, Integrating Medical Family Therapy in Private Practice for the class, Introduction to Medical Family Therapy. What we're going to be doing today is discussing how to integrate medical family therapy into a private practice. A couple things we're going to cover along the way. Pretty much, what is medical family therapy and what is its history? Where did it come from? What are the four pillars that create and hold up medical family therapy? What are possible screening protocols? What are the workflows involved when a positive result comes from the screening? What are some possible behavioral health interventions? What does this mean for your practice? How can you apply it to your practice? And wrap up with a couple quick things at the end. First and foremost, I want you to know that medical family therapy is collaborative care. And what this means is that it looks at all aspects of a patient to consider their health. It looks at their medical and physical conditions. It looks at their mental conditions. It looks at how family intersects with themselves to create the entire environment of who they are. The best way to look at it is think of primary care as treating the body. Think of mental health as treating the head, and think of medical family therapy, collaborative care, as being the neck that connects everything together. Medical family therapy started as it was noticed that there were many challenges in the healthcare system in the 1980s. There was little to no collaboration between physicians, physical and mental health services, staff, and providers. Mind and body were diagnosed and treated separately. They were not considered to be connected in any way. And the patients presenting symptoms were the focus of the treatment. A couple things to think about really quick, and just answer these to yourself. I want you to think about medical family therapy and think about some global issues of medical family therapy. What are some global issues of medicine? Now I want you to think about your private practice. What are some micro issues within your practice? Are there any similarities between the global issues of medicine and between the global issues of your practice? All right. Where did medical family therapy come from? It was developed when therapists began to be included in medical schools with residency programs to help residents learn to understand how the mind and body are connected and work together. Over time, it was discovered that this is really more than just a niche. It should be a specialty, which is what it's become now. Medical family therapy collaborates across all aspects and all ways of a treatment plan and in a facility. It collaborates, forces collaboration horizontally and vertically across the care team. Some possible treatments and specialty demographics would be chronic illness patients, autoimmune disorder patients, late in life patients, and end of life patients. We use this to create seamless, culturally competent medical environments for mental and physical care for the patient. Okay, the four pillars to medical family therapy, also known as the four worldviews of medical family therapy. What is needed and what is required to hold it up and make it work? The first is the clinical aspect. We look at the treatment standards for patients. We look at the practices of treatment, and we look at how to make it holistic. We want to make sure that we are considering the biological and psychological aspects of a patient's health. We want to understand how their social environment influences their health, and we want to incorporate their spirituality, the belief structure that they themselves and their family unit has and uses to create meaning within their family. Operational, or pillar number 2, looks at the workflow, communication, and infrastructure within an office. Medical family therapists will integrate therapy into primary care workflows and environments. They help to build and establish warm handoffs between providers, and they help to develop shared charting and record keeping protocols and procedures. Therapists are also readily present and available, both physically and virtually, when the time arises and as needed. Medical family therapists are also developing and providing staff training on how to coordinate and collaborate across all care teams, and so that all of these care teams understand the importance of collaborative care. The third pillar is financial, the funding, the billing, and the sustainability of the practice. By incorporating reimbursement models that focus on behavioral health services, we create more funding. By utilizing cost-saving practices, we are able to control billing. And this is done through chronic disease management, putting focus on reducing treatment overlap, reducing unnecessary testing, and reducing unnecessary office visits. The longevity of it all, the sustainability, is there to create a competent medical staff that patients will pick up and notice when they walk into the office. When patients notice and feel that they are being treated by competent staff, their patient satisfaction rises, which increases patient retention, and that decreases staff turnover, creating higher sustainability. Next is the training aspect of medical family therapy, the education, supervision, and professional development. MedFTs will work to develop staff training and provider training on what it takes to provide collaborative care, and that everyone must work together and commit to this new philosophy. They will develop ongoing mentoring and coaching for providers and staff on the policies and procedures as they change over time. And they will also develop continuing education that promotes cultural competence of the patients, for the providers, and the staff. Next, we're going to talk about some screening tools and protocols. Let's make sure, though, that we understand that screening tools must be easily available for the providers to provide for the patients. The results must be easily understood and easy to replicate to measure ongoing treatment. A couple examples of medical family therapy screening tools would be the Mood Disorders Questionnaire, the Vanderbilt Inventory for ADHD, Mini Mental Status Exam, and CRAFT. The Mood Disorder Questionnaire is used in primary care. It usually takes about 5 minutes to complete. It's fairly accurate. 7 of 10 patients are correctly identified with the first test for any possible mood disorders they may be experiencing. The Vanderbilt Inventory for ADHD takes about 10 minutes. There's 2 components. First of all, we want to assess symptoms. Secondly, we want to assess the impairment of performance. How do their symptoms affect their ability to function? The third protocol or third screening tool is the Mini Mental Status Exam. This is used with elderly patients who are either hospitalized or institutionalized. It is a scale test that considers a patient's educational level and their age norms. It takes about 5 to 10 minutes to complete, and it's easy to replicate and measure results to chart ongoing treatment. Last but not least, CRAFT. CRAFT is a test provided by primary care for 14 to 21-year-olds. It has 6 questions. The first is, have you ever been in a car where the driver was under the influence of substances? The second, do you use substances to relax? The third, do you use substances alone? The fourth and fifth, do family and friends say you should reduce your consumption? And the sixth, have you ever gotten in trouble while using substances? The workflow for providing these screenings, we want to make sure that it is held during routine medical exams and primary care. They're administered by physicians and nurses. If positive results come out of these tests, then there's a warm handoff where the physician will then bring in the medical family therapist to provide further testing. After the further testing, the medical family therapist will collaborate with their primary care provider team to develop different treatment plans that are either short or long-term, develop goals for treatment, and incorporate the family unit and make sure that the treatment is culturally appropriate. We want to make sure that any interventions we use are evidence-based and that they're scientifically based with measurable outcomes. We want to make sure they're repeatable and patient-centered. And one of the interventions or modalities to show as an example would be solution-based brief family therapy. Focuses on the solutions, not on the problems. The patient is the expert of the patient. The provider is not the expert on the patient. It is goal-oriented and it is strength-based. It does not focus on the problem. It focuses on the outcome. In regards to individual and family treatment plans, individual treatment plans focus on the patient. It focuses on their physical and mental health, and it includes personal goals. Family treatment looks at the dynamics of the family unit and how illness affects the family and the relationships within the family. A comprehensive care model would be to incorporate both individual and family treatment plans, start with the individual to assess the patient, and then further expand to include the family unit for positive outcomes. Now, finally, what this means to you in your practice. The benefits of incorporating medical family therapy in your practice. It will improve patient compliance. It will improve family and relational dynamics, or uses family and relational dynamics, clarifies symptoms, and provides more accurate diagnoses, which reduces costs within the office. It is a collaborative decision-making process that includes the patient, the family, and the provider, increases patient satisfaction and retention. It encourages cultural competency where the staff and providers not only are aware of their patient's cultural background, but of their peers' cultural background to create an inclusive and collaborative environment. One last thing about having a medical family therapist on staff is that they are readily available when emotional issues arise, such as family disputes and grief issues. In conclusion, medical family therapists provide cultural competency for providers and staff. They guide the patient's family unit through emotional turbulence, and they contribute to clinical sustainability with increased return on investment. I'd like to thank you very much, and good day.